Good afternoon. Thank you for taking your time this afternoon to be with us to talk about swine flu. Let me start by saying that Alabama has had no cases of swine influenza. However, given the great concern that has been expressed both at the national and increasingly at the international level, and the ongoing spread of the illness in the United States, I think it's important to share with you what we have currently done and how we are trying to lean forward to deal with what could occur in Alabama. I think it's important to recognize that yesterday the Centers for Disease Control suggested that it may be impossible to prevent further spread of this outbreak. As a consequence, it's certainly possible that over the next several weeks, we in Alabama will be affected like 5 other states have already been affected, and probably others are in the process of working outbreaks. I think the first message to say is that there have been now 20 confirmed cases in the United States. All of them, unlike the cases in Mexico, all of the cases in the United States have been mild disease. Obviously, there is a great deal of discussion about what's going on in Mexico with something in excess of 1,000 human cases, somewhere between 60 and maybe 80 deaths reported by various media. In the United States, we've not had any deaths. We've had only 2 hospitalizations, and there have been no serious illnesses. And we certainly would hope that is the ongoing, continuing nature of the illness in the United States. What I really want to do this afternoon, beyond setting this background, is to talk a little bit about what we can do as individuals and what the state of Alabama is doing to prepare to respond. First, and let me deal with this as individuals, we are at the end of our historic influenza season. So the good news is one would begin to anticipate influenza declining in the state, and it has been declining over the last several weeks. We would hope that would continue. But given this new potential threat on the horizon, I want to encourage people to redouble their efforts so that if they cough or sneeze, that they absolutely cover their mouth with their sleeve or with a tissue. Washing your hands often to prevent the opportunity of spreading viruses between individuals. Don't rub your mouth, your nose, your eyes simply because it's a way to infect yourself. Limiting your exposure when possible to people who may have cough and other evidence of illness is important. Trying, very importantly, if you develop an influenza-like illness, and we're going to talk a little bit more about that, please don't come to work, don't go to school, stay home. That becomes extremely important in controlling this potential illness. Now that's what we as individuals can do. What we've asked today, we've been communicating with physicians and hospitals around the state. What we've asked them to do is to move to a more aggressive posture of testing for influenza. At this time of the year, it would be traditional for influenza testing to decline. But what we're asking is for physicians and hospitals who see patients with influenza-like illness to continue testing for influenza. We're working now to make available additional influenza viral culture material. We are encouraging individuals who may have influenza-like illness, fever, cough, stuffy nose, muscle aches, and some people with this strain of influenza have reported diarrhea and vomiting. People with those illnesses who have been to areas where the disease is spreading, such as Mexico, who've been to parts of California, to parts of Texas, now parts of Kansas and Ohio, where we are seeing, and New York City, where we are seeing this disease spread. If you develop an influenza-like illness, please see your physician, see your healthcare provider. They then would be in a position to test you. Our mission here is twofold. Number one, it is where necessary to ensure that individuals who need access to antiviral therapy get early access to antiviral therapy. It's also so that we can identify early cases of swine influenza if it occurs in Alabama, and then we can work very carefully around those cases to identify contacts, to identify individuals who may have been exposed, so that we can try to minimize spread using all of the tools available to us. So in addition to those targeted activities, we're also leaning forward in terms of pre-positioning supplies so that should we need to respond in a more aggressive way, we'll be able to do that. So at this point, I think the message I would just sort of like to leave is that we've been spared so far swine influenza. We don't have any reason to believe we've got any cases right now, but given the nature of the disease, that it is now spreading from person to person, we are seeing cases occur in people who have no direct contact to other known cases. It's almost certain that the disease is now spreading, if you will, under the radar, and it's certainly possible that Alabama will see one or more cases in the coming days and weeks. The good news is that it has been mild disease so far. We certainly hope that it will remain mild disease, but given the nature of the disease in Mexico, we have to be concerned that the disease could become more severe. So we simply want to be prepared. We're encouraging additional testing on the part of physicians, and we're encouraging individuals who have symptoms of influenza and who've been to places like Mexico to please seek medical care so as to ensure that we can identify early cases and take appropriate preventive measures. With that, let me turn it over to Jim Walker, the head of Homeland Security. Jim?
Thank you, Doctor. Good afternoon, everybody. I'm here representing Governor Riley today. Dr. Williamson and I have both been in constant communication with the governor. And first, I know that the governor would like to commend you and your team for your leadership, Dr. Williamson, in helping the state lean forward in wrestling with the swine flu that seems to be impacting Mexico and now our country. And I think the governor would like for me to say, first of all, that this is a team effort, that all state agencies and organizations are leaning forward to assist Dr. Williamson and his staff in helping prepare our citizens and respond as need be. You know, it's interesting, the governor on the 10th of April sent out a memo to all state agencies and organizations talking about preparing for pandemic and encouraging all of the members of the administration to begin looking at ways to identify missions, resources, key government functions that would need to remain in place should we become overwhelmed by this catastrophe. So this is not new to us in the state of Alabama. In fact, it's something that we've been working on for a number of years. And in fact, following the governor's memo on the 10th of April, he and Dr. Williamson co-hosted a pandemic exercise on the 13th of April here in Montgomery, where we brought state agencies and local organizations in and talked about the impact of the state and state services and our citizens. So as we ramp up here, we know that citizens in Alabama, by and large, are responsive to the calls of government when we ask them to take certain measures. And we know in this particular case that it's an issue of we have the ability now to allow to influence the action as opposed to having the actions influence us. And so we're trying to lean forward, be proactive, encourage our citizens to practice social distancing, to wash their hands, to take precautionary measures. I would also like to add that in concert with Secretary Napolitano's comments today at a White House press conference that they've declared a public health emergency, they've also notified Customs and Border agents and Transportation Security Agency agents to begin doing passive screening of folks coming into airports and coming into ports of entry. We obviously have a port of entry in the state of Alabama. You know, Carnival Cruise Lines routinely goes back and forth between the port of Mobile and Cozumel, Mexico. So the border agents working in Mobile will be looking at passive screening of citizens returning into Port of Mobile for some sort of symptoms, and then pulling those folks off and testing them, providing them with things going into the near future. So we're doing what we can to lean forward, and again, whether it's the Commissioner of Ag and Industries or Emergency Management or the State Troopers or the National Guard or any of the assets or resources that are at the governor's disposal, he is committed to do whatever it is that he can to assist in whatever is needed in the weeks and months ahead.
Thanks, Jim. Let me now turn it over to questions.
Do you feel like with the Port of Mobile, Carnival Cruise Lines, that is a higher risk for Alabama to get a case of the flu?
Well, I think the reality is that it certainly does provide a potential site of entry. However, I think it's equally likely that if you've had now 8 confirmed cases in a high school in New York who presumably flew on planes back from Mexico, that anybody on that plane could have also acquired infection, because remember, influenza is infectious for up to 24 hours before people are symptomatic. So one of those other passengers from, pick a state, Illinois, could have acquired infection, and then they fly on a plane, and somebody from Alabama flies on that same plane, and then all of a sudden, that's sort of the under-radar transmission that's going to go on. I don't think it's possible at this point, from everything that we're hearing on conference calls that seem to now be almost continual, to assume that we're going to be able to put a fence around a state and say we can do something to keep it out. I think it is probably too deeply spread now into the population to prevent it from spreading by any concrete action we can take at the borders, if you will.
If by chance an older Alabamian were to contract this, they really need to check.
Well, I think that there are 2 messages here. Number one, the thing that is perhaps makes this an especially concerning virus is that it has this characteristic of the 1918 pandemic. What we worried about with avian influenza, this I think shows how unpredictable influenza is. We've been talking all this time about avian influenza and worried about bird flu, and now it's a flu from pigs that we're concerned about. But the characteristic here is the people who are dying at high rates, at least preliminarily in Mexico. Please realize that this is subject to change and the data is uncertain, but it appears to be largely 20 to 40-year-olds. It's younger people. Now, that's not to say that the elderly and others with pre-existing medical conditions couldn't be put at high risk. If they became ill, they absolutely could, and perhaps that would serve as a reason to make sure they do get treated. But right now, at least in Mexico, it seems to be disproportionately younger people, people you wouldn't expect to be dying. And that's pretty characteristic of some of the pandemic strains in the past.
Doctor, we've seen the severity of the virus in Mexico. If it does travel into Alabama, we do see a few cases. Is this something that is easily treatable if it's caught early, or what sort of treatments are available?
I think that's the interesting thing. And it's one of those things that there are teams on the ground in Mexico right now trying to understand. I mean, now we don't have samples from every virus of the 1,000 people in Mexico, but they do have samples of virus that are the exact DNA and antigenic match of the virus that's circulating in the United States. And yet that virus in Mexico has killed roughly 4 to 6% of the people who acquired it. And in this country, it's no worse than regular influenza. So the question I think that has to be asked is, are we seeing something different in Mexico in terms of background infection, or is the virus in Mexico evolve to be more serious and maybe it started out like we're seeing here? We just don't know that, and that's going to be the critical fact to acquire. The good news about this virus, though, let me make sure everyone understands. The state of Alabama has stockpiled over 500,000 courses of antiviral medication, a combination of Tamiflu and Relenza. This virus, the H1N1 swine flu virus, is sensitive to both of those drugs. So if we find ourselves in a situation where we need to begin using antivirals, we have plenty of antivirals. We also now have been given access to additional courses of antivirals by the federal government this afternoon. And we have antivirals, and we have a virus that fortunately responds to the antivirals.
Can you tell us about the safety precautions, not coughing into your hands, rubbing
Sure. I think most of us as we grew up, we covered our mouth when we coughed. Well, the net effect of that is you simply put virus on your hands, and you facilitate the transmission from your hands to the person's hands you shake. So that's why we do talk now about if you're going to cough, either cough in a tissue that you can dispose of, cough into your sleeve, your elbow, so that you don't get it on your hands. But even beyond that, it's critically important. Our mothers told us this, and they were right. Washing your hands turns out to be one of the most important things that you can do to limit transmission of the virus. So hand washing becomes critically important. Staying home if you are ill, not going to work, not going to school, becomes critically important. Maintaining a distance, trying not to get within six feet of someone who is ill avoids some of the risk of transmission. So it's basic common sense at this point.
Sir, you have a couple of phone
Okay.
calls. The first one is from WAKA in Montgomery.
Yes, doctor. I know earlier you've talked about how the cases in the United States, unlike in Mexico, are mild, and I know you're also saying that you're taking the proper precautions, but let's be clear. How exactly dangerous is this swine flu? Could this be on par with the 1918 pandemic we had with the Spanish influenza?
The simple answer is no one knows. Let's go over what we do know. We know that we have a virus that, based on the numbers out of Mexico, there's somewhere around 1,000 cases. We know that at least now, WHO, the World Health Organization, is confirming 20 deaths due to this influenza. The various other sources are reporting numbers 60 as high as 81, and I'm sure that number is going to go further north. If you simply do the math, that gives you a death rate of somewhere between 2% and roughly 6%. During 1918, the 1918 pandemic was believed to have a death rate of about 2%. So in Mexico, based on the very preliminary data you've got, it would be a very concerning situation. But what we don't know, really, is how many mild cases are there in Mexico that, for whatever reason, aren't getting reported in the system. We don't know if what we're seeing in the United States is the more typical presentation. And unfortunately, the only way we're going to know the answer to this is going to be additional work in Mexico. We're going to need to follow the cases that now are believed to have occurred in New Zealand, the cases that are believed to have occurred in Canada, and undoubtedly there will be other cases around the globe in the coming days. And we're going to need to track the natural history of that. So today you can't say it's either going to be a very mild outbreak, nor can you say it's going to be the 1918 pandemic. It's simply too early.
Thank you.
And you also have a call from the Decatur Daily on the phone.
Good afternoon.
Hi, this is MJ from Decatur. Yesterday I heard television commentators talking about a possible cross contamination or a sort of superbug that is swine flu, possibly other things mixed in with swine flu as it had previously had been known. And I've heard you saying that this is a new virus. But are you suspecting, or is the federal government suspecting that this is also bird flu or SARS?
No, no. The genetic markers of this. Swine flu has been around for a long time.
Right.
The classic swine flu is H1N1.
Right.
That's the virus that caused the 1918 pandemic. It's the virus that was circulating during the regular flu season this year. But it was human H1N1, or at least H1N1 that over a period of 90 years had basically acclimated itself to humans. When you look at this swine flu, you find that this swine flu has components that are not traditionally and have never previously been reported in swine flu that affects humans. You see an avian component. You see I think it's called an East Asian component of swine flu. You see a human component. You see a new reassortment of the virus that has antigenic or has markers and characteristics that we've not seen before. So remember, if we go back to what does it take to have a pandemic virus, it requires a virus that's newly introduced into the human family, for which none of us have immunity. It requires a virus that's easily transmissible from person to person, and it requires a virus that causes more severe disease than you normally see. Well, let's look at what we've got here. We clearly have a virus that's not previously caused disease in humans. We don't have immunity to it, and let me be very clear, the influenza vaccine that we would have each received during the regular flu season does not provide protection against this virus. We have no reason to believe that it is protective, because human swine flu and this virus seem to be very, very different.
But you're also saying that it's not bird flu, that people were feared.
No, no. I mean, we've always
and
said
it's not SARS.
No, it's not SARS and it's not bird flu. It is an H1N1 influenza virus that is new to humans, so it has pandemic potential. It is transmissible from person to person. I think there is still some discussion about how transmissible. That's one of those things we're going to be that's going to be being looked at very carefully in the coming days. And then obviously the third big issue is how bad is the disease that it causes. So I think we have now, if you will, we're almost just a little past kickoff, if this were a football game, in trying to figure out where we're going with this. We have a virus. We have it being spread from people to people. How easily it's going to be spread is an issue, and how much disease it's going to cause is going to be an issue.
We also know that that the swine flu is not transmissible by eating pork.
Yeah.
So.
And that's important. I mean, that's obviously important. It is not. You're not going to get it by eating cooked pork. Yes, ma'am.
Talk a little bit more about the antivirals. How would they help, and when and how is the determination made whether or not to start administering those?
Well, antivirals are most effective if given within the first 2 days. Ideally, the sooner after onset of illness, the better the response. In terms of using the antivirals, that really becomes clearly in patients who may be compromised. They may have diabetes, may have pulmonary disease, and then they develop, whether it's regular influenza or whether it's swine influenza. Treating them reduces their risk of long-term complication and death. Where the real issue is the use of antivirals around prophylaxis, using it for contacts, using it for household members who may have been exposed, to try to prevent those individuals from becoming ill, and trying to limit their ability to spread it to other people. And the Centers for Disease Control, and I haven't looked at their most recent ones, which probably are out in the last 30 minutes, have a set of recommendations that we will use to guide us in recommending to physicians about who and when they use prophylactic antivirals.
I just have a quick question for Director Walker. As far as these passive screenings at the port of entry, could you tell us a little bit about that? And if you do find someone that may be infected, what steps will you take?
It's interesting. We asked that question about 10 or 15 minutes ago with a conference call with our friends in Washington. And what we do know and what we don't know is that as talented as the folks that work for Customs and Border Patrol are, they're not qualified medical officials. So the answer that we were given is they will look for common flu-like symptoms in people that are coming off planes, off boats into our port. If somebody's ambulatory, obviously, but if they're showing symptoms that are a cause of concern, they will segregate those folks from the others that are leaving the ship or the plane or the airport, give them some rudimentary testing, perhaps give them a mask, counsel them on social distancing, proper hygiene. If they continue to show symptoms, to go home and stay home. If you're going to a hotel, stay in a hotel. Try to limit your contact with other humans. So it's just basic get ahead of the curve stuff right now that I think the nation and the state and our local communities are trying to get a grip on before we're dealing with something that could potentially be much more damaging to us.
In planning for bird flu, because yeah, a lot of planning went on, and it's like this swine flu has just come out of the blue here. What's gone right? What's gone wrong as far as what we had in place for bird flu and how that translated in planning for this?
Well, I can tell you one of the things that we're doing better now in the state of Alabama is that we have a fusion center not too far from here. It started out with a bit of a law enforcement focus, but now it encompasses so many other areas of government, whether it's agriculture, emergency management, health, and what they're doing is looking at trends in either animal health, trends in people health, any relationship to crime that's occurring, anything in the state, and we've got a number of analysts to include input from our health friends that will help us see if there is some sort of a connection between all of these things that there should be cause for concern with. I think that's one of the things that sort of evolved not only in terrorism and crime and natural disasters, but also in areas like bird flu. So the point is the state has a lot more capability now. Dr. Williamson and his team are clearly getting out ahead of the bow wave, taking proactive steps. They're bringing in other state agencies. We're keeping the governor constantly engaged. He knows what resources he has available to him. And now it's an issue of working with our public health partners at the local level, but then importantly, reaching out to our citizens and say, hey, look, it's going to go from person to person, and you have to be at the tip of the spear as an individual citizen in practicing good hygiene, social distancing, be responsible if you're sick, and if we can stay ahead of these things now, perhaps the worst of it won't affect our communities or our state.
Let me follow up on that. I think don't draw a distinction between responding to bird flu and responding to swine flu. The whole response has been built around responding to a pandemic, okay? And whether it was H5N1 bird flu, H7N2, which is a different bird flu, or now H1N1 swine flu, it doesn't matter. The response is the same.
How did it already kind of get so bad then?
Well, I think that's an interesting question. I mean, and I think that's one of the things that people a lot smarter than I will have to figure out. How did Mexico end up with almost 1,000 cases, 60 deaths before it suddenly became an issue? And I think that's a conversation that'll happen between the governments of the United States, the government of Mexico, the World Health Organization. I think that's one of the things that we learn from that. And let me tell you the thing that I think we need to learn from this, and where we are today. I think we actually are in a fairly good place. I mean, as I said earlier, we are in the tail of our standard flu season. So unless we are just extraordinarily unfortunate, we're likely to see, just because it's warmer, people are going to be outside, they won't be clustered as much, a diminishing capacity for spreading influenza virus over the coming days. All right, does that mean it's over? If, let's say, we have no cases, or we have 1 or 2 cases, and all of the influenza problems are gone in 3 weeks. Does that mean that we dodged the bullet? It absolutely doesn't, because I would remind you what happened in 1918. What happened in 1918 was what was viewed as a classic flu season, and then several months later there was this major increase in influenza with extraordinarily high death rates. So one of the classics of a pandemic is that you get waves. And so what we may have, if we're fortunate, is a window where we and private business and everyone else can redouble their efforts so that we're prepared if we get a second wave. Hopefully we won't, and hopefully whatever we get is going to be extraordinarily mild. But at least it does remind us that what people have been saying all along really is true. We are going to have another pandemic, whether it's H5N1, whether it's this H1N1, the one that now we're all so very concerned about. I don't know. But I do know that the virus will find a way to mutate and present to us problems we've not previously experienced.
They're having, just getting to the time of year, they're having events and things outside. Right. Like May 2nd, there'll be the Crawfish Bowl in Birmingham. Hundreds of people are going to be going. Do they need to be worried about going to an event like that, or? Well,
I mean, let us see how this evolves. Mexico City obviously has canceled substantial numbers of events this week. Whether or not something like that would be necessary in this country, It's going to depend on what happens with the outbreak. If the outbreak gets worse, then we'll have to consider all options. If it remains very mild, very isolated, then probably it's not such a great concern. All right. Listen, folks, thank you so very, very much. And with that, if there are no other questions, we'll end. Thank you.